So most patients concerned about the packs which we need to insert in the nostrils after the operation, and these are important to stop any eventual bleeding, but also to keep the structure in line until they heal properly. And usually the packs needs to be in place for a few days. However, in the past with the standard technique, we use some very hard and heavy packs which were blocking the airflow so patients can breathe completely. But now with the preservation rhinoplasty, because it's less traumatic and less invasive, we can now use some different type of packs. So they are just like silicone splint with a hole inside, and patient can breathe straight away after surgery. This means that they are not uncomfortable, they can sleep at night, they can breathe straight away, and they can stay in place even for a week, for 7 days, without causing any problem.